behalf of I would like to extend a very warm welcome to all of you. We appreciate your time off your schedules today to join us for today's webinar, Pharmacist's Role in the COVID-19 Pandemic in conjunction with World Pharmacists Day 2021. The theme for this year is Pharmacy, Always Trusted for Your Health. The aim for today's webinar is to promote and advocate the role of pharmacists in the fight against COVID-19. For today's session, we will first have our prayer led by Awang Muhammad Hishamuddin, followed by welcoming remarks delivered by representatives from Universiti Brunei Darussalam and Universiti Malaya. Then we will have presentations from our speakers. After presentations, we will have our panel discussion where participants can post their questions to the speakers, and lastly, end with a photo session. As a start to our opening, I would like to invite Awang Muhammad Hishamuddin to recite Surah Al-Fatihah and recital of the Aslamat.
Al-Fatihah. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Arrahmanir rahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Allahumma inna nas'aluka salamatan fid dini wa afiyatan fil jasad wa ziyadatan fil ilmi wa barakatan fil rizq wa taubatan qabla al-maut wa rahmatan 'inda al-maut wa maghfiratan ba'da al-maut. Allahumma hawwin 'alaina fi sakaratil maut wan najata minan nar wal 'afwa 'inda al-hisab. Rabbana la tuzigh qulubana ba'da idh hadaitana wa hab lana min ladunka rahmatan innaka antal wahhab. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wassallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Subhana rabbika rabbil izzati amma yasifun wa salamun ala mursalin walhamdulillahi rabbil alamin.
Amin, amin, ya Rabbal Alamin. Thank you, Hisham. Before we begin, I would like to, there has been a complication. So we will actually take the pictures first right now. So I request everyone to open their cameras with the background that we provided through email. Can everyone please open their cameras? There's still a few people who has not opened. I did get the email. Actually, Dr. Working. Can we please have everyone to open their cameras for a photo session before we start? All right, I will take a picture of the first slide because there is 3 screens. Okay, 1, 2, 3, smile. Okay. The next slide. 1, 2, 3, smile. All right. That's all for the photo session. Thank you. You may close your cameras if you want to.
I'm supposed to speak now? Okay, sorry. All right, okay, so Bismillahirrahmanirrahim. Assalamualaikum.
Now, to begin the seminar, we are pleased to have Dr. Hajah Masrinawati binti Haji Abdul Hamid, representative of PAPRSB Institute of Health Sciences, UBD, to deliver her welcoming speech.
All right, thank you. So Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning to our special guests this morning, our esteemed speakers from Universiti Brunei Darussalam, Dr. Dayangku Nurul Aini from University Malaya, Madam Shirin, and from Universitas Gajah Mada, Dr. Ika Puspita, colleagues, lecturers, students, ladies and gentlemen. It is indeed my pleasure this morning to welcome everyone to this first international public webinar conducted virtually entitled Pharmacist's Role During the COVID-19 Pandemic. And this is in conjunction with the World Pharmacists Day 2021, which is held annually every 25th September. And this time, this event is organized by the pharmacy team at the Pengiran Anak Putri Rashidah Sa'datul Bolkiah Institute of Health Sciences, Universiti Brunei Darussalam. As introduced, I'm Dr. Masrinawati, and I am representing our Dean of Institute of Health Sciences, UBD, this morning, who unfortunately is not able to be with us this morning. So ladies and gentlemen, the International Pharmaceutical Federation, the FIP, encourages pharmacists to use this day to organize activities that promote and advocate for the role of the pharmacist in improving health. And it is one of the objectives of this virtual webinar. World Pharmacists Day was adopted by the FIP Council in 2009, World Congress of Pharmacy and Pharmaceutical Sciences in Istanbul, Turkey. And September 25th was chosen as it was the date when in 1912, the FIP was created. So with the theme this year, Pharmacy, always trusted for your health, it is timely to celebrate this event together. Many patient-pharmacist relationships are grounded in trust built over time. The public trusts pharmacists' advice. They trust pharmacists to maintain confidentiality, and at a time of uncertainty, and when vaccines hesitancy remains a major hurdle, like currently we are experiencing, public trust in pharmacy is more important than ever before. So pharmacists can give advice based on the best scientific evidence, thus making the role of pharmacists becoming more significant. Our pharmacy team here at UBD has been actively organizing various events since 2018. And in 2018, the UBD pharmacy team collaborated with the Ministry of Health, Brunei Darussalam, to take part to promote our pharmacy degree program at the Bandarku Ceria event, as well as other activities. Later on in 2019, UBD held a seminar on science, medicine, pharmacy, and pharmacology in Islamic history and civilization. And last year, despite the pandemic, UBD team has successfully organized a public health screening event at one of the health centers in Brunei. And that was at the Jurudong Park Medical Center in Brunei Darussalam. So this year, again, despite Brunei being hit by the second wave of the pandemic, we are organizing a collaborative event with Universiti Malaya and Universities Gajah Mada for this webinar. So in this opportunity, I would like to acknowledge and appreciate the contributions by the panel of speakers for this international webinar, especially by our own academic, Dr. Dayanku Nurul Aini from UBD. My sincere appreciation as well to Madam Shirin from Universiti Malaya, as well as Dr. Ika Puspita from Universities Gajah Mada, Indonesia, for being able to share their knowledge and expertise during this webinar. So finally, I would like to thank the organizing committee for bringing us together this morning and organizing this event. I hope you will achieve the stated objectives and the webinar will be beneficial for everyone here. So I wish you all a very fruitful session. Thank you very much. So stay safe during this challenging time. I end my speech. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.
Thank you, Dr. Hajah Mas, for the wonderful remarks. Now we would like to invite our second guest, Dr. Izyan A. Wahab, the representative of Faculty of Pharmacy, University Malaya, to deliver her opening speech.
Thank you very much, Aina. Thank you. Can I just double check you can hear my voice, yeah?
Yes, Doctor.
All right, thank you. So Assalamualaikum and very good day to Dr. Mas Rinawati, Deputy Dean of Graduate and Administration, UBD, esteemed speakers, colleagues, lecturers, students all over the world, ladies and gentlemen. On behalf of the Dean of Faculty of Pharmacy, University Malaya, Associate Prof. Dr. Hasniza Zamanhuri, she expresses sincerest apologies for she couldn't make to this event because of unforeseen circumstances requiring her commitment. So this World Pharmacist Day 2021 is very special, it's very unique because it sees how every single pharmacist around the world have become resilient, great, more than ever during this tiring time. All sectors greatly affected by the pandemic, though pharmacists still stand tall to deliver continuous pharmacy services to the public. Hence the theme of this year World Pharmacist Day, Pharmacy Always Trusted for Your Health. So this health covering not only physical, but also mental health as well, that is greatly tested during this time. However hard, difficult time it is, there are new or improved pharmacy services due to this situation. Okay. Hence, this webinar serves the purpose to share contribution from pharmacists who are also academicians to public during COVID-19. So the Faculty of Pharmacy would like to thank you, PAPRSB Institute of Health Sciences, UBD, the pharmacy team, for reaching to us to collaborate, to co-organize this wonderful event. We hope that all of you can listen, engage where you can while sipping your coffee. So with that, thank you so much. That's all from me.
All right, thank you, Dr. Izian. For the next session, I will now pass the floor to our moderator for today's webinar, Rauda Mohidin.
Okay, thank you, Aina. As everyone may have known, today we will have presentations from three speakers: Dr. Nurulaini Kifli from Pengan Anak Putri Rashidah Saadatul Bolkiah Institute of Health Sciences, Universiti Brunei Darussalam, Madam Shirin Alwi from Faculty of Pharmacy, Universiti Malaya, and Dr. Ika Puspitasari from Fakultas Pharmacy, Universitas Gadjah Mada. After the three presentations, we will have our panel discussion where you can post your questions in the Zoom or the YouTube chat box with the format speaker's name _ question. You can post the questions after the end of every speaker's presentation. Your questions will be compiled to be answered during this panel discussion. Without further ado, we will proceed to our first session with our guest speaker. I would like to welcome and introduce Dr. Nurulaini Kifli. Dr. Nurul is currently a Senior Assistant Professor at PAPRSB Institute of Health Sciences, UBD, as well as the Program Leader for Bachelor of Health Science in Pharmacy. She has been appointed as the leader for UBD's Herbal Research Team and a board member for the Brunei Darussalam Pharmacy Board since 2016 to the present day. She graduated with a Bachelor of Pharmacy with honors from Cardiff University in 1998. She then received her PhD in medicinal chemistry from Cardiff University in 2003. Her research interests range from traditional medicine, complementary medicines, natural products chemistry, medical and pharmacy education, and cervical cancer studies. Today, she will be presenting on the role of pharmacists in Brunei to combat the COVID-19 pandemic. Everyone, let's welcome Dr. Nurulaini Kifli.
Let me just share my screen. Bismillahirrahmanirrahim. Can I just make sure everyone can hear me? Yes, I can see a nod. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Rauda, for chairing this session. Once again, I welcome Dr. Hajah Masrinawati, our Deputy Dean at the Institute of Health Sciences, UBD. Also, Dr. Izian, representing the Dean of Universiti Malaya. Also, the distinguished speaker, Dr. Ika, and also Ms. Shirin. And thank you, everyone, actually. I know Saturday is not your working days, but thank you for joining us. Whereas in Brunei, we work on a Saturday. So thank you for joining us during your weekend. And yes, right. And may I, in this opportunity, thank the organizing committee and also the speakers for your time and your energy to actually join us. Yeah, I know it was a short notice as well. And also happy World Pharmacy Day for all pharmacies around the world. Right. The topic of my presentation is the role of pharmacists during the pandemic in Brunei Darussalam. I hope you can see my slide. I'm already sharing the screen. So my talk will cover the role of pharmacists during this COVID-19 pandemic in the area of education, research, pharmacy practice, and also community contribution. As an introduction, as we all know, the coronavirus pandemic has been a huge challenge to all of us. It affected all sectors, as mentioned by Dr. Izian just now, yeah? But it has revolutionized the pharmacy education and also pharmacy practice in some positive ways. Just to give you some overview of the global pandemic, in fact, already more than nearly millions of deaths, yeah, nearly 44 million deaths already being recorded globally. And there's 26 million active cases throughout the world. So it's really affected. And with the emergence of various variants as well. So this is really a concern to all of us. Just for an update, for those of you who are not from Brunei, maybe Brunei know this already. The Brunei just been hit by the second wave starting in August, not last month. I thought it's still September. So our active cases has increased. So as of yesterday, there's 210 new cases, but in fact, the active cases has reached up to 2,233 and there's 32 deaths, yeah, so far. So the Brunei overview is here. I think this can be obtained from the Brunei Health app that we have in Brunei. So active cases are to around 2,000, but it's good to note that around 4,875 recovered patients have been recovered, yeah. So the new normal begins in 2020, that is last year, the COVID-19 pandemic spread across the globe, yeah. Majority of countries announced temporary closure of schools, so that has impacted more than 90% of students worldwide. So this also is the same case in Brunei, where UBD, the higher institution, has been temporarily closed as well, because Brunei has announced the one confirmed case since the 9th of March last year. But as the month progressed, Brunei government managed to control the cases down. I think we only the government have released some of the curfew up in May or June, yeah. So following semester, we kind of were able to meet some of our students face by face. But on 7th August, Brunei was once again hit by the second wave due to the emergence or the appearance of Delta variant of the COVID-19 virus. So this time round, it is very fast, the infection, yeah. So it was different, totally different from last year. COVID-19 pandemic has led to very substantial changes in the pharmacy program curriculum, including all face-to-face assessments such as physical examination as well as clinical skills exams such as SKI, the objective structured clinical examination, amongst others, were also affected. So let me go through just briefly on some of the learning that we have undergone due to the pandemic, learning beyond classroom. So before COVID, these are some of the various pedagogies used. So for example, we can do it with face-to-face in small room with a simulated patient and doctors, clinical phase still ongoing, lab practical, and also some IPE sessions. This involves a lot of students, not just pharmacy. It's the medical student, dentistry student, as well as nursing student involved in the interprofessional education section, PBL. So all this was not able to be conducted after the pandemic happened. So post-COVID-19 pandemic, assessment for all core modules were converted to 100% coursework as no physical exam was conducted during that time. So all were converted using online platforms. So we have utilized our LMS, Learning Management System, that we UBD use, which is Canvas. We also use the Zoom. I think it is quite popular because it's very easy friendly. And also UBD have started to secure or what the MS Team. So we have just recently used MS Team last year, but now I think everyone is very well versed with the use of MS Team, I guess. And research deadline were affected as well. Because some of the students were not able to conduct their research in the clinical settings or go to various places. So these are some examples. We we managed the examination using these are invigilating using Zoom, and you see this because we lifted already the restriction. This was happening in November and December, but still we use online examination. So the pharmacists at UBD, so I call them the academic pharmacists, we also trying to learn and relearn what we know. So we attended a lot of CLC workshop, meaning a workshop to use to utilize the online platform. So one of the workshop we attended is utilizing MyDispense software. So hopefully by this time we will be using this MyDispense software. So basically this is a digital software application to support key learning goal to enhance the pharmacy student experience. I think Dr. Izuan was also one of the key members joining this training. Yeah. So another thing that I would like to highlight that the pharmacy team was doing, Dr. Shiba here, she organized the virtual interprofessional education utilizing Zoom platform. So this was a challenge because it involved around 80, 90 participants, and also because as well as facilitators. So that's a big number to manage a small breakout room session. So that was a challenge, but it's also the new norm, I guess, that we have to adapt to it. And we also do journal club assessment by the year 3 student using Zoom. Another thing that we learned during the new normal, or everything has got to be online. So we, some of our teaching was done using problem-based learning. So that's a small session with the year 1 student. So we did this using MS Team. We'll also be using virtual lab session using ChemLab software. This is a software that we bought last year, more on the chemistry part. So that will be taken up by myself. Another thing that I would like to highlight, the pharmacist role, so more on the academic side still, the research are now more geared to COVID-19. So some of the output that the pharmacy team published few manuscripts in a peer-reviewed journal on COVID-19 related topic. It's not to say that we're not doing other research, but it's just saying that because of COVID, this topic also appeared. So it's just really interesting. So topic like risk factors, mobile health app, so everyone is utilizing health app nowadays. Treatment. This is from Dr. Hui, and this is from Dr. Long. So some of the research were being published as well during this time. So few more others, potential therapeutic option for COVID-19. Right. Pharmacy practice, in terms of pharmacy practice, so this more on the clinical pharmacists in Brunei. So just a disclaimer, I got this data from one of the pharmacists in the Ministry of Health. So working from home become the norm for some of us, while others were being deployed entirely to work to face the patient to take their clinical roles. Yeah. So pharmacists and pharmacy technicians from Ministry of Health deployed to the vaccination center at the National Indoor Stadium as frontliners. So our role has changed to become frontliners to manage the safe and quality supply of vaccine. So some of the role were to supply and manage the vaccine, manage the proper storage of the vaccines, and also manage if there's any break in cold chain, quality control of vaccine, if there's any defect, why stages, supply other medicines needed for vaccination centers. So for example, emergency supply trolley, all the usual paracetamol tablets, and monitor any adverse effect in the vaccination program, yeah, so or any other quality issue related to the vaccine. So these are some of the portals also I gather from the Ministry of Health. So it's our pharmacists from Ministry of Health working at the site, National Vaccination Center, a pharmacy technician taking a daily check. So in the National Vaccination Center, I know they vaccinate around 2,000 clients per day. So that's a huge number, yeah, for Brunei, exactly. So pharmacists as frontliners, some of the pharmacists also work at the quarantine center where it's popularly known as PKBN, and also National Isolation Center. So this is in the Tutong district, the Tutong Hospital, yeah. So where they order stocks and items required for this patient, involved in treatment plan with the patient, as well as working together with doctors and nurses, dispensing inpatient and discharge medication to patient, dispense manual prescription for staff by the doctor, supply what stock to the center, supply vitamins. So vitamins is very popular nowadays, and answering doctor's queries on medicines, ensure also the proper storage of the fridge item. So their role are very significant during COVID. Yeah. So I think it's all similar as well as in Malaysia and Indonesia. Pharmacists as frontliners at PKBN and NIC. Another thing that the pharmacists do because of the during this time, pharmacists need to work proactively to manage any medicine shortage. So medicine shortage were major risk during initial outbreak, especially Brunei. We don't have pharmaceutical industry to manufacture our medicine. We all have to know this. We rely most of our medicines from overseas, yeah? So this is really, really important. So pharmacists at the Ministry of Health working really hard to make sure all these shortage are being resolved, yeah? So patient access also to see doctors in hospital and also health centers are also restricted due to COVID pandemic, COVID-19. So there's a surge of medicine supply for chronic patients taking long-term medicines. So Ministry of Health has collaborated with GoRush. This is a company that deliver patient medicine. So I think there's an agreement being signed with this company only to deliver patient medicines via the Easy Collect scheme. So they have advertised this program. So it's very easy. I utilize this for my parents as well. So you can just email or make a phone call, yeah, to request this. And they now have dispense instead of 1 month, they have dispensed 2 months supply of medication. So, but this it would increase the workload of the pharmacists and also pharmacy technicians. So they really, I hope they're keeping well and keeping their health well. They really are also stressful, I think, during this pandemic. Yeah. So this is the Easy Collect scheme by GoRush. So they have publicized posters. So the posters you can see is in Malay, so that public can understand well. So it will take around 3 working days to be delivered with just a $3 charges. Yeah, even outside the district. Another role that pharmacists may have, I would like to highlight here, is a community pharmacist. So, for example, Guardian in Brunei have now gone online shopping experience. They have created this, I think, similar website with Malaysia as well, but they only activate this only this year after the second wave happened. And then they're doing more remote consultations. So pharmacists have utilized technology more and more nowadays, even via just a normal telephone or WhatsApp, because this is for their own safety as well. This enabled them to reach patients who could not leave home, who could be on isolation, or they could be just don't want to leave home, yeah? So they could be using runner services. Runner in Brunei is quite popular. It's actually a person who deliver any item, can range from food to medicine, yeah? So we call it runner to supply their medicines. also, I was told there's an increased demand of vitamins, especially vitamin C and D and zinc, I suppose, and flu medicine supply. So social media have played an important role to give awareness to public on the importance of boosting immunity. So because of this, public are buying in bulk and stocking up their supply, which is a good thing, but then stock run out very fast. So because of this, sometimes it also stops going, yeah. So that's another issue. Flexible hours or could be shorter time given due to the COVID-19. So this will allow time to manage the supplies and so clean on these disinfectant premises. So these are some of the Guardian pharmacists. I found this in Guardian IT. I didn't manage to speak to Christina, but I hope this is on public domain anyway. So these pharmacists are now advertising on the use of antigen rapid test kit, which were recently introduced in Brunei because of the second wave. There's increased surge of cases, and we want people to also be vigilant about it. So this is I think this is also at affordable prices, but they are just showing on how to use the test kit and fingertip oximeter, you know. So this is the first thing. So finally, I would like to touch upon the community contribution. So this is mainly by us, UBG. So UBG vaccination program was introduced in Brunei in April this year under the Ministry of Health. So I would like to highlight few of our ways in Brunei. Ministry of Health have consulted UBD senior management team to operate the UBD vaccination center. So part of our office or building is now being converted to UBD vaccination center just after 1 week discussion and planning. So this was a really critical move. Is really nationally is affected by this pandemic. Yeah, so we need to step up. So as part of a wider plans to support the rollout of COVID-19 vaccination, so most of us academic from the Institute of Health Sciences, UBD, including pharmacists, doctors, nurses, paramedics, as well as midwiferys, have provided our service. I call that a community service to voluntarily support this one goal of the nation, which is to vaccinate at least 80% of the population of Brunei. We opened since 21st of August, so I was also one of the key people involved in the planning, as well as other people. I'm only in charge of the vaccine. So now the vaccine approved for use in UBD vaccination center are AstraZeneca, Moderna, and Sinopharm. Although we do have Pfizer, but it's not being used yet in UBD. It's used in other healthcare centers. UBD Vaccination Center have now vaccinated over 13,725 clients. And that's quite a big number. And as of 30th of September, 43% of the population received full dose. So Brunei is also planning to inject teenagers between 12 to 17 years old. They are talking about it. In fact, it's today. And also Brunei is also planning to do booster dose, especially for the frontliners. These are bad. So yes, consent are being asked. So pharmacists and pharmacy students as well as other students, biomedical students, nursing students are working very hard as I'm speaking now. They are working now today at the central processing area. So the one in charge there are 3 pharmacists and 6 pharmacy students. Sorry, I only mentioned pharmacy because of the World Pharmacy Day. So faculty, these are some of our faculty contribution to the community. This is not this year, this was last year. We did some, we made our own made face shield led by Cikgu Amin. He's very creative. It's actually easy to make. And we donated some medical consumable to the frontliners. So these are just some of the few. Last year, as mentioned by Dr. Masrina, we organized World Pharmacy Days in collaboration with JPMC. The theme is Transforming Global Health. We did some health screening, and this year we just can only do this. In summary and conclusion, this semi-lockdown period has highlighted the potential for pharmacies as well as pharmacists to take a wider role in primary care in the future. Academic pharmacists also has to learn and relearn new skills to adapt to an innovative way of teaching and learning. Clinical pharmacy, especially the Ministry of Health and other private sectors, has to adapt to new ways of working that involve social distancing, enhanced cleaning regimen, and also utilizing new technology. Public are much more aware now about the community pharmacist role, where to get their medicine supply, especially for just over the counter of medicine, pharmacy medicine. And we hope that the profile of pharmacists in Brunei will be raised after COVID or during COVID, despite our small number. Just for your information, we only have 98 registered pharmacists in Brunei. I know we are small in number, but our total population is also small. Yeah. So these are us a day before the second wave. So these are when we trying to celebrate the sixth cohort. Yeah, the sixth cohort of pharmacy student during the opening of the semester. Thank you very much. And next week is my email. Thank you very much for listening. I stop sharing.
Thank you, Dr. Nurul, for the informative and interesting presentation. For participants who have questions for the speaker, I would like to remind the participants once again, the panel discussion will be at the end of the seminar. So participants, you may compile your questions for the speaker in the Zoom or the YouTube chat box. Now, I would like to welcome and introduce our special guest speaker from Universiti Malaya, Madam Shirin Alwi. Madam Shirin is a lecturer at Faculty of Pharmacy of Universiti Malaya, and she is also a member at Malaysian Pharmacist Society Council. She graduated with a Bachelor of Science with Honours in Pharmacy at Liverpool John Moores University. She then received her Master's in Clinical Pharmacy at University Science Malaysia. Madam Shirin's field of interest is in pharmaceutical care practice, quality of medication prescribing, pharmacotherapy in cardiovascular diseases, and pharmacy education. Let's welcome Madam Shirin to give her presentation on pharmacists as the frontliner at UMMC Vaccine Center.
I'm sorry, Rhoda. I just got
Yes, Doctor.
text from Madam Shirin just this second ago. Madam Shirin, internet just disconnected because of heavy rain at her place, but she's now trying to reconnect. So this is so quite unexpected.
Okay.
What about, can I ask if we can proceed with Dr. Ika if she is around? Because Madam Shirin actually in this webinar, but then just got disconnected.
Okay, I understand. Dr.
Sorry
Ika,
for that.
are you ready to present now? Dr. Ika, can you hear me?
Rauda, can we have short 3 to 5 minutes break, please? Just to ensure Dr. Ika and Madam Shirin. Dr. Ika. All right, Dr. Ika, how are you?
Hello, Dr. Ika.
Good. because this is
Your
I'm in
lifesaver. Thank you
the
so much, Dr. Ika.
yeah, I'm in the vaccination session right now, so that's why sometimes yeah
It's okay, Dr. Ika. Thank you. Thank you so much.
yeah. So my time is now.
Yes, if you're ready, it's up to you, Dr. Ika. When you're ready, you can share your
It's
slide.
okay. Yeah, I will
Thank you.
share my screen. Here we go. I think you can see now. Is it clear?
Yes, Dr. Ika, it's perfect. Thank you.
Okay, thank you.
Dr. Ika.
Yeah, good morning, everyone. Sorry about my time because this is the vaccination session in our university with drive-through method. So that's why sometimes we also did something in different ways. For example, while during vaccination, we also attending the webinar. And many thanks for all the participant and also the invitation from Brunei and also Malaysia. For my session, maybe I'll talk quite different. Some may be same with the previous one, but also sometimes it's different because in Indonesia, maybe in the setting in pandemic is quite different. So that's why here I made the contribution from Faculty of Pharmacy UGM as an academician and also pharmacist. And here we also have Bu Endang Lukitaningsih as a Vice Dean of Community Services and also Mas Soni Siswanto as one our junior in Community Services as well. What happened in Indonesia may be quite different with Malaysia and Brunei. As we know, at 2020, around April, we got the lack of VTM, viral transport media, for the important COVID-19 tracing in Indonesia. Maybe this did not happen in other countries, but this is what did happen in Indonesia. And at that time, some of the doctor got the problem, and also the we call dinas kesehatan or health office in province and also in the district also have the problem with viral transport media, because we know that from the very beginning of COVID-19 happened, Indonesia only have the VTM as a donation from China. So that's why at the time, we didn't realize that we will combat with COVID-19 for many months since March, I think, yeah, in Indonesia, March 2020. So that's why at that time, in every cities, yeah, not only in a rural area, but also in big city like Yogyakarta, where UGM is in the Jakarta, and also other cities, big cities, all of them also have the same problem, lack of viral transport media. Then I will talk about this later. And then next, the high demand of personal protective equipment testing. As we know that one of the problem also
Sorry, Dr. Ika, can I just interrupt for a minute?
So
Yeah. Sorry, the slides are not moving. Can you just press the button which is there in the bottom to give us the PowerPoint slide? You can, if you want it to be easier, there is the small read button. You can do that also.
Yeah. But I think I'm still in the background or problem here.
Oh, okay.
Yeah. Because I will make my story based on the background here.
All right, thank you.
Oh, yeah, thank you. Yeah, so Indonesia also felt that the personal protective equipment tools, we don't really have it. So that's why we always ask from other countries. Then at that time, more of the tailor in the city try to change. They don't make it the what we call cloth, but then they change to make the personal protective equipment with the different kinds of materials. So that's why we call it UKM, or middle, or what we call it small and medium enterprise. They made the personal protective equipment to support the hospital, and then for the what we call in the shelter, the village and also university shelter. So that's why we need to make the testing method. We got the testing method for the material for personal protective equipment, but then this is very expensive and we have to send to Bandung, other cities. Maybe this is around 8 hours by train from Yogyakarta. So that's why Facultas Pharmacy, Faculty of Pharmacy UGM try to solve this problem and to provide the personal protective equipment testing freely, no charge. I will talk about this one. Also, the high mortality rate in COVID-19 patient, they usually or they prefer to have the self-isolation in their house. Maybe this is because of the psychological boundaries. As we know that we have to go to other house, then we have to separate from my family member. This is not easy for Indonesian. So that's why the high mortality rate in COVID-19 patient made us to set up the shelter. And then also vaccination, as Yogyakarta province is the one of red area, means that we don't have the student to come to Yogyakarta. We can open the mall or shop. Only the important facilities such as hospital that we can open, and then for like a shop that provide for the things like food only can open around 10 a.m. until not more than 6 p.m. So that's why we try to make Yogyakarta as a green area with the community empowerment. Here we can see that for tracing, the important is not only the flock swab tools, but also viral transport media, because without viral transport media, the appropriate one for COVID-19. This is the problem in Yogyakarta itself and also in Indonesia in some areas. So that's why we try to make the viral transport media based on our free website and also UL website. So thanks Belasal made the VTM itself. We need the sterile isotonic
Yeah, I think we lost Dr. Ika for a while. Let's wait for a few minutes to her to reconnect back. I think this is quite common, yeah, to have a webinar whereby these things happen, yeah. And these are the challenges. I think all can just wait for a while. Yeah? I think all important information from Dr. Ika is very, very important for us all to think about. Especially she directly involved in the setting up all the PPE from UGM and so on. So I think it's really, really, I think precious for her to share with us today.
I can see her screen come back. Yeah, she's back now.
Welcome back, Dr. Ika. If you can unmute your microphone back, yes. And reshare again your slide, yes.
Yeah, so we try to check the recipe from CDC and also WHO, that as a pharmacist, we know that on the viral transport media, it comprises of the sterile solution, isotonic, and also we need the protein compound for the viral, and also to overcome the contamination from fungus and also from bacteria. So we need the antibiotic and also antifungus compound. And of course, we need to maintain the pH level from viral transport media. So this was what we made. Hopefully it works. Yeah, so this is the viral transport medium formulation that we obtained from CDC. We tried to make the recipe by ourselves, not by commercially. And then this is our team. Yeah, so this is the unpaid voluntary team. So we try to knock the heart, as we know that we are in Indonesia. Some people struck by COVID-19, then some of them already lost their job. So that's why I try to maintain the team from our faculty. At least we still have payment from the government. So that's why don't we to make the viral transport media for national needed. So that's why we make the unpaid voluntary team for VTM production, comprised of lecturer or academician, and also the analyst or laboratorium staff. And this is financial supported fully by the faculty as a community services activities. And then when we already made the viral transport media, we send it to the hospital and also primary healthcare facilities in Indonesia. We distribute it nationally, for example, in the West, Middle, East Java, and also Yogyakarta. And some also sent to Papua. This is maybe needed the 5 hours by flight. So that's why we try to maintain the VTM at the cool box, yeah, so we can maintain the temperature to until 8 centigrade degree. This is our production, and we already have the Indonesian Ministry of Health letters or permission, yeah, because this is very important because we also distributed not only in our area but also in other province. The HPSS-based VTM that we made comprised of Hang's Valen salt solution and added by 2% of fetal bovine serum, gentamicin, amphotericin, and we also make the regular testing for pH level, the contamination of fungus and bacterial before we distribute it. So this is the legal letter that we have, because this is important when we distribute to other area. And then this is the testing of personal protective equipment that really important here. The production made by small and medium enterprise, so they don't have enough money. So that's why for this testing, our faculty give the free of charge. This is really how we as a pharmacist can contribute, depends on our community level, as we know that they are in the medium and small enterprise, but they also show the big contribution to our area to produce and also to provide the better personal protective equipment for the hospital. In a day, we can perform 20 until 30 pieces. And we also have the team. This is Bu Endang, yeah, as a PIC. I myself as a PIC of viral transport media. And what the other problem happened in Indonesia? This is around the end of 2000 when we have the problem with fully occupied hospital. While the community, they only have a low knowledge in COVID-19. And then government also don't have the sufficient equipment, financial support. So that's why the high mortality rate happened at that time. We then move to, is it possible that we empower community? As you know, Yogyakarta culture still have a big, what you call, this is, we are some like a Japanese culture that we always help each other based on what you call, this is like working fee. Like working fee means that we always try to help people without money. Yeah, this is a kind of our culture in Yogyakarta. So that's why we try to use this behavior to empower community to set up the shelter. This is the shelter in the village. Shelter in the village, for example, here, and also some disease shelter in our university. What the difference is, in the village, we don't have the doctor, we only have nurse and some also pharmacists. But then in the university shelter, we providing doctor, nurses, and also pharmacists to work together, because this is as a conjunction of the hospital. For example, in my hospital as an academic hospital from UGM, so that's why we try to make the different shelter. But at least in the shelter, in the village shelter, we try to reduce the mortality rate as we work together. For example, the villagers also support food and also some other equipment, for example, masks, and also some supporting like hand sanitizer, also what you call in the village, they always try to help others in the village and then send together to the shelter. It means that the emotional behavior that they shows give the good relationship with the patient. As we know before, some they have the judgment that the patient never give the support from other villagers. But now with the shelter, we can work together here, supporting anything what we need with the villagers. And also this is the community empowerment based on the district or village area. This is the room, yeah, because this is some we use school because we know that all of the school didn't use at the time, and also some the acts of hospital that they already abandoned before, yeah. So we use all of the houses that we can use for the shelter. And this is the university shelter that we providing doctor, nurses, and also pharmacists, meaning that the patient, that the condition getting worse, so then we can send it to the hospital fast than other shelter. So this is the difference of the villagers and the university shelter. But all of them supporting by alumni, yeah, pharmacist alumni donation and also other faculty donation, yeah, for setting the villagers and also the university shelter. And in Yogyakarta, we only have 2 districts, yeah, that providing the shelter, both of village and also university shelters. So that's why maybe in some area, this is not easy to educate people. This is not easy to ask people to involve in our empowerment model, but we didn't stop. Yeah, as a pharmacist, we try to collaborate with medical doctor, nurses, and also district government to set up the shelter because they can give the benefit to reduce the mortality in their villages. And then lastly, this is the vaccination because we have the what you call in Indonesia, we have the jargon, yeah, the vaccination for all. So in a house, we need the vaccination for all the family member, not only for the student because we need to open the school, but for all in our houses, for the driver that we have, for the servant that we have. So that's why we made the different kind of model of vaccination. For example, here, this is the vaccination that we perform with the collaboration with the army. Yeah, so as the army, they had more than more vaccine than other institutions, so that's why we collaborate with army, yeah, and we perform the vaccination in the university with the conventional model, but then we also have the drive-through model. Right now, I also have the vaccination drive-through in the Faculty of Medicine in UGM, and pharmacy always helping to maintain the cold chain of the vaccine, as the previous speaker mentioned before, and we also splitting, yeah, preparing, because when we did the drive-through and also for many people in the village, we need for the fast fast response and also fast vaccination method. And also we have the disability community, yeah, not only the student with the normal ability, but also disability community. We also try to give them the vaccination. Of course, this is not easy method, but we try to give the vaccination for all. And the pharmacy is very important because in a day, sometimes we send our staff in more than 3 areas. Yeah, so we quite busy in this, I think 2-3 months, yeah, until December, as we try to make Yogyakarta as a green zone. Then student can come to the school. As you know, that Yogyakarta is a student city, yeah. So that's why we try to make the Yogyakarta as a green zone and vaccinate all people in Yogyakarta. For the conclusion, we look at the COVID-19 as an encouragement. This is not for the war with the disease. This is not what we made our heart, our knowledge, and our skill to decrease, but the COVID-19 gave us a bullet to combat with COVID-19 itself, with our knowledge, our skill, our heart. Yeah, so that's why we in Pharmacy UGM always look at the COVID-19 as an opportunity, yeah, to flourish our faculty, to give our as a academician, to look at our community. Don't try to forget the community. As pharmacists become popular, no, yeah, because they know the pharmacist now. This is kind of branding event, yeah. Then the community will know pharmacists as well, not only we as a health worker, but they will know that pharmacists always give the opportunity, give hand for the community to combat the COVID-19. Thank you. This is the end of my presentation. Maybe I give different story, yeah, because Indonesia is quite different with other countries. We still have some limitation, but we try to give our pharmacist knowledge, skill, and ability with our heart for our community to wake up from COVID-19 together. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Dr. Ika, for the fascinating and informative presentation. Okay, Dr. Ika, first of all, I would like to apologize for not introducing Dr. Ika earlier, but I will now introduce Dr. Ya, just to give brief information to our participants about Dr. Ika. As everyone may know, Dr. Ika was the head of the pharmacy program at Faculty of Pharmacy, Universitas Gadjah Mada from 2016 up until this year, and she is currently working as Human Resources and Academic Director at the Academic Hospital of Universitas Gadjah Mada. She graduated with a Bachelor of Pharmacy from Universitas Gadjah Mada in 1995, and from 1995 to 1999, she pursued a master's degree at Universitas Gadjah Mada. Then she received her PhD in Biomedical Sciences, Monash University in Australia. She also did postdoctoral research in the Faculty of Medicine, Yale University in the United States. Dr. Ika's research of interest is on antibiotic, pharmacokinetic, pharmacodynamic and resistance, molecular biology, obstetric gynecology disorders, pharmacotherapy of endocrine and metabolic diseases, and reproductive control in males and females. Once again, Dr. Ika, thank you very much for sharing with us your expert opinion on the contribution of academicians and pharmacists in Indonesia during COVID-19 pandemic. Now, without further ado, I will proceed to introduce our last speaker for the day. May I know, Madam Shirin, are you ready to present now?
Yes, I'm in. Can you hear me?
Yes, I can hear you, Madam. Okay, now we will share the screen for you.
Can you see my screen?
Yes, Madam.
Okay. Shall I start now?
Yes, you may start, Doctor.
Okay. Assalamualaikum, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh to everybody. I am so sorry I have to switch off my video. I'm just afraid that my internet connection is quite erratic at the moment because it's raining heavily here. Thank you, first of all, thank you to the organizing committee, the organizers, for having me here, for inviting me to speak on behalf of Universiti Malaya. I'm Shireen. I'm a clinical lecturer in the Faculty of Pharmacy. Okay. So what I'm going to talk today is basically what we do, actually, what academicians do in Universiti Malaya and how we helped out in the Universiti Malaya Medical Center, okay, vaccine center. So before that, I would like to introduce what is UMMC basically. So Universiti Malaya Medical Center, UMMC, is basically 1,617 bedded tertiary hospital in Petaling Jaya. Petaling Jaya is outskirt of KL. Okay, it's not in the city center, but it's in the outskirt in KL. It's just about nearby. It is a teaching hospital for dental students, for medical students, for pharmacy students, for nursing students, for your biomedical students. Okay, it's just next to Universiti Malaya basically. Okay, it's just next, so it's about 300 meters from our faculty, so we can just walk from our offices or our lecture theatres to the hospital. It is a referral center basically from smaller hospitals throughout the district, throughout the state basically. Okay, if you can see what we have here, we have this Universiti Malaya Medical Center has been tasked to provide what they call it, a pusat pemberian vaksin khas, ataupun they call it a special PPV center. Okay, it's not the same as the normal PPV centers throughout the whole Malaysia. It is that's why they call it special. Okay, I will explain to you why it is special. So basically, where we are, if you can see this building, the gray and the red stripe, we are here at the 13th floor, at the top floor here. Okay, where you see the whole row of windows there, we are there basically. Okay. So what's the difference between the SPPV and the normal PPV that we have in Malaysia? Okay, the SPPV so far, there is we have one in UMMC, and then there's the other one in USM Hospital, USM University Science Malaysia, which is in Kubang Krian in Kelantan, okay, up north. The SPPV is basically a referral center for patients who have that require further monitoring and further examination and close monitoring. Let's say, for example, if you have gone to any of the PPV, the normal PPV, and the doctors in the PPV are not keen to vaccinate you or are not able to care for you if anything happens, then they will refer you to an SPPV. Basically, the SPPV is near a hospital, or in a hospital, so that anything happen, the hospital is next by and the treatment can be given to you as soon as possible. So who are those people? The patients that usually comes to our center, the vaccine center, is the one who are immunocompromised patients, patients who are HIV positive with AIDS, or who are on long-term high dose steroids, or on immunosuppressants. Okay, patients with multiple comorbidities, patients have medical problems, diabetes, asthma, kidney problems, patients cancer on chemotherapy. Okay, sometimes patients who had COVID stage 4 and stage 5 before, okay, warded for stage 4 and stage 5 COVID, then they will come for the vaccination in our SPPV. Patients who have very severe allergic reactions, okay, develop anaphylactic shock, or develop basically if you have low BP or high BP immediately, things like that. Okay, so what's the difference between the SPPV and PPV? The other one is that not only that it is near the hospital, and we also have emergency doctors, emergency department doctors on duty throughout the whole session, throughout the whole session. So anything, we'll just refer them to, we refer the patients to them. Then they will treat immediately, whether they want to bring down, whether it's just simple enough to give some antihistamines for Piriton if the patients develop a generalized rash, or they will bring it down to the emergency department for further investigation or examinations and things like that. Okay, or if they need the patients to be needed to be warded, then the patient will be warded immediately. Who are those people that helped out in the SPPV in UMMC? Is basically staff from UMMC. We have nurses, we have medical doctors from various departments, even doctors from pathology department, radiology department. Those are non-clinical related doctors also have to help out. Okay, they were always on rotation. Who are those people? We have registered pharmacists from the pharmacy department in the hospital, and also registered pharmacists in the Faculty of Pharmacy. So those registered pharmacists from the Faculty of Pharmacies are basically academicians. Okay, academicians who are basically pharmacists, and they are registered basically because when you sign the consent form, you have to have a your pharmacist registration number. So that's why they need a registered pharmacist. Also, we have registered dentists from the Faculty of Dentistry. This is also dental doctors, dentists, medical dental doctors. Okay. We also have students also come in. At one point, we have medical students, we have pharmacy students, we have nursing students. Okay, who helped out in the SPPV. In our SPPV, we have what we do is we usually have we gave out Pfizer, which is Comirnaty, and Sinovac, and almost about it depends on the session. Sometimes we have 500 patients, sometimes we have 1,200 patients per day. Our shift runs from 8 to 8. That means 8 o'clock in the morning till 8 o'clock at night. So if we have 1,200 patients per day, and more than 70% of them are first dose, so our shift will end at 10:30 at night. Sometimes it's like that. Okay. Yeah. So it depends on the number of patients per day on that day. So basically, what do we do? Okay. So pharmacists in SPPV, as mentioned earlier, we have the pharmacists from the hospital, which is the servicing side, okay, from the hospital pharmacists, and we also have pharmacists from the Faculty of Pharmacy, which is the academicians, the lecturers. Okay, so basically in general, the one that is looking after the vaccine is the pharmacist from the hospital. They will make sure that they have the vaccines, the cold chain are maintained. Most of the time they will transport the vaccine. They will take the vaccine early in the morning from a hospital Kuala Lumpur or JKWP in JKWP means Jabatan Kesihatan Wilayah Persekutuan, administrative office, a health office, okay, in Cheras. Then they will bring early in the morning. They will bring the vaccine to the hospital to UMMC. Then from UMMC, half of it will go down to the main store to be stored in the walk-in freezer in the storeroom, and another half, or maybe about how many, depends on the number of patients, how many vials they will bring up to the PPV center. So they will use a special container lah, where they have this monitor the temperature and all that. So usually in the morning, all the staff who are on duty at that day, they will be having a briefing. The sister in charge, the staff nurse in charge will tell us how many patients are coming on that day, who are those people, whether they are patients who are from maybe patients from pediatric clinics, patients from oncology, patients from surgical and things like that. And then how many first dose, how many second dose, how many vaccines for Pfizer, how many recipients for Sinovac and all that. And at the end of the day, they will say that, okay, we'll start once the pharmacist comes in with the vaccine. Okay, so once the pharmacist comes in with the vaccine, then what the pharmacists have to do, the pharmacist has to document. Most of the time when they receive the vaccine, when they take the vaccines from the other centers, from Hospital Kuala Lumpur or from JKWP, they will store a packet, or maybe depends on the number of vaccine counter. Let's say, for example, if we have 14 vaccine counter, they will store 14 first or 28 vaccines vial first. Okay, because it takes half an hour for it to thaw. Sorry, it takes half an hour for it to thaw. So they will thaw, and then once the vaccines had been thawed, so once they reach the SPPV, then the vaccines are already thawed. The first batch of vaccines has been thawed. That is this is basically the inventory control and documentation. What happened is that vaccines, if you thaw it at 8 o'clock, you have to use it within 2 hours. Okay, once you reconstitute, you have to use it within, once you reconstitute, you have to use it within 4 hours. So you cannot thaw it at 8 o'clock in the morning and use it at 5 o'clock in the evening. So they thaw it by batches and by batches. So who are those people who are in charge of how many vials are thawed at 9 o'clock in the morning, how many vials are thawed at 10 o'clock in the morning, things like that? That will be the pharmacist. Okay, so they will have to all the documentation. So this batch of vials thawed at what time and what time it can be used, and how many vials of water for injections and syringes to be given to the nurses so that they can reconstitute the vaccines and things like that. Not only the inventory control is not only on the vaccines, but they also control the vaccine card. Each of the patients who had received vaccine, they will receive a vaccine card. So they also control the vaccine card in the sense that you do not want to give the vaccine card to those people who have not vaccinated but claim to be vaccinated. Okay, so that's one of the roles also the pharmacist has to do there. One of the important things about inventory control is that for Pfizer, one vial is 6 doses. Okay, so once we have 6 patients, they will reconstitute one vial. Once we have 6 patients, they will reconstitute one vial. So towards the end, sometimes the patients will come in one by one, you know, sometimes they will come in, sometimes they will come in late, sometimes they will come in. So what they will do together with the nurses in charge, they will group them together. Once they say, okay, we have 6 recipients that is coming, at what time, once everybody is here, all the 6 people, only then they will reconstitute the vaccine. So in terms of when they do that, they prevent wastage of the vaccine. They do not want to store and reconstitute the vaccine, but there's no recipient. Okay, so the administration or the control there is very important. So they make sure that the patients, once they thaw and reconstitute, the patients is already there to receive the vaccine. Okay. Then the other thing is the rest of then we have what the pharmacists can help do also in the SPPV is basically at the screening and triage and pre-vaccine counseling counter. This is where when the patients comes in, they will first register. Okay, when they register, once they register, the registration counter is basically being meant by the hospital, the administrative staff in the hospital. So once they register, they will straight go to the screening and triage and pre-vaccine counseling counter. There, what we'll do is basically we'll ask them, do you have any allergy history? If you have, are you allergic to any medication? Are you allergic to any food? Okay. Do you have any adverse effects to any of the vaccines before? What is your past medical and medication history? Things like that. Are you on any blood thinning medications? Things like that. So the reason we ask these questions is basically we need to know whether the patient should receive Pfizer Comirnaty or should receive Sinovac. Okay. We need to confirm that because if the patient has already allergic to some medication, some injectable medications, and that injectable medication has what we know that they contain ingredient such as PEG, polyethylene glycol, which can cause allergic reactions, and Pfizer Comirnaty has that PEG in its vial. So if patients are already allergic to PEG, we don't give Pfizer Comirnaty. We will give Sinovac. Okay, so those are the things that we the reason that we ask why we need all these questions before. And then the other thing is also we need to look at whether the patient needs to be in the 15 minutes observation center or the 30 minutes observation. Okay, if patient is having asthma, uncontrolled asthma, despite on high dose corticosteroids, inhaled corticosteroids, or despite frequent use of SABA, short-acting antagonists, okay, the SABA semua, okay. So if the patient has uncontrolled asthma, despite all those, then we will also give patients 30 minutes observation. Also, if the patient has severe allergic reactions to some medication and things like that, so we also give 30 minutes observation. The reason being is that the longer the observation, that if the patients develop allergic reactions to the vaccine, we should be able to catch it then. Okay. So those are the things that the pharmacists will need to ask the questions that when they are doing screening, triage, or pre-counseling vaccines. Also, the pre-counseling vaccines, what we have is also we tell them as the normal things lah. The arms that you have been vaccinated will be a bit achy, a bit painful. Some people will develop fever. If you have fever, you can take some paracetamol. If you're not allergic to paracetamol, but then we tell them, but if you develop any of the symptoms, for example, you have swollen neck, swollen face, you have a generalized redness, very pruritus, very erythema, body in rashes all over your body, if you develop a difficulty in breathing or shortness of breath, if you have palpitation or increased rapid heart rate and things like that, then they will tell them to refer to the doctor and things like that. So we have to inform that what they are supposed to expect, and we have to also to so that they are not, and they sometimes some patients also they are a bit scared. We have to inform, we have to calm them. No, this vaccine is good because of this, but the normal reaction is this, things like that. So the screening, triage, and pre-vaccine counseling counter, it can only be manned by medical doctors, dentists, and pharmacists. So yeah, it's between the three groups only. It cannot be manned by any other groups. Okay, so nurses cannot be there. Radiologists or physiotherapists cannot be there. There's only three groups of people that is allowed to sit in at the screening, triage, and pre-vaccine counseling and counters. And you have to sign the consent form. So anything, your name is there, your registration number is there. So anything happen, you are also liable. That's why it's, they only give permissions to only the three groups of people. Okay. After the patient has gone for the counseling, pre-vaccine counseling, they will go to the nurses the vaccine counter to be vaccinated. Okay. Then based on the whether it's a 15 minutes or 30 minutes observation, they will go to the respective area. They will be observed for 15 or 30 minutes. Once their 15 minutes or 30 minutes observation is ended, they will go to the observation counter. These observation counter are manned by medical doctors, pharmacists, dentists. We have also physiotherapists, occupational therapists. We also have radiologists who comes in. I've met some speech therapists also on duty on that day. Okay, so the observation counter is a mixture of professionals. What we do there, we observe the patients to make sure that the patients will not do or do not develop the allergic reactions, okay, the signs and symptoms of allergy. And we also make sure we have confirmed that they have received their vaccination in the system, the Malaysian Vaccine Administration System, MyVAS, I call it. Okay. We at the same time we make sure when they comes in, I have this experience, one patient who comes in after 30 minutes, what we call it in Malaysia, muka macam ataupun muka macam udang kena bakar. Okay, very red, very he did not notice it. The patient themselves didn't notice it, but when he comes to see us, we can see macam very reddish and things like that. And then we asked him, is this your usual wait, I mean, are you usually this red? And then only then he say, why am I red? He did not notice that. Okay, so when we have that kind of patients, then what we do is we usually refer them to the emergency doctor. Okay, so only then when the emergency doctor said see him, and the emergency doctor said, yeah, he's already having the reactions, the allergic reactions already. So at that time, I think the emergency doctors inject him with some Piriton injections. Okay, antihistamine injections, and make him stay for another half an hour in the emergency area. Okay, so that's basically what the observation counter all about. At the same time, also what we do is we have post-vaccine counseling. Okay, post-vaccine counseling is the same thing like the one we reiterate what the pre-vaccine counseling has mentioned to them. What, let's say for example, your arms will be a bit achy, sometimes it will be a bit painful, some people will develop fever. Okay, but if you have this symptoms, any of these symptoms, please go to see a doctor immediately, things like that. Okay, and what to do. Okay. Some patients say, okay, I already have some antihistamine at home. I've developed generalized rash throughout my body. Should I just go and take my Piriton, for example? I'm a very well versed with these allergic reactions and things like that. Okay, but when it comes to that, you have to see what are the symptoms that the patient has. If the patient has the blood pressure has dropped, then he cannot just take Piriton. He has to go to see a doctor and see how it's being treated. Okay, so the pharmacists in the post-counseling session have to do to inform them what to do, and at the same time also, if you have any of these AEAFI, that means adverse reaction after vaccination. Okay, they have to get them to report it in the app, My Sejahtera app. In Malaysia, we have My Sejahtera app, which track you everywhere you go. Let's say, for example, if you want to go to a supermarket, you have to scan the app. Then the My Sejahtera app, okay, will know that you have gone to that supermarket. If you go to the department to teach, you have to scan the app. Okay, so My Sejahtera will scan everywhere you go. So if you have the same thing also, if you have allergic reactions or you have any reactions toward the vaccine, you also have to report into My Sejahtera app. Okay, so the pharmacist has to inform that to patients, that you have to inform, so that then what happened is that My Sejahtera will link it to the professional body, what they call it, national regulatory body. Then the national regulatory body can come up with, okay, how many recipients of, let's say, for example, Comirnaty in the whole Malaysia, how many patients, how many people develop fever, how many patients develop rash, how many patients develop this. So they have the figure. So if we do not tell the patients they need to report in the My Sejahtera, then they would not be, the national regulatory body would not be able to get that figure effectively, correctly. Okay, so before we come in and work in the SPPV, we have to read up all these resources. Okay, now in our SPPV, we are vaccinating pediatric patients. That means patients from the 12 years old until 17 years old. So this guideline for pediatric has just been released at I think about 3 weeks ago, about 3 to 4 weeks ago, because we started vaccinating them about 2 weeks ago. Okay, so these are the guidelines that all of us has to read up and make sure that at least we have it and in hand if we need it. I remembered I called up Dr. Izan one morning. She was reading this guideline inside the car while waiting for her shift one morning. Okay. Okay. So this is some pictures. This is where we worked at the SPPV. This is our our hospital director, Prof. Nazira, opening the SPPV. Okay, this is the 13th floor that I mentioned, our SPP center. This is the first picture on the left. This is registration counter. If I think I can introduce you. Everybody call him handsome. Maybe we think that he would be handsome. This is our health minister, our current health minister, okay, Yang Berhormat Khairi Jamaluddin. So YBKJ came to our SPPV and visited our SPPV at one time. So this is our registration counter where the nurses and the hospital administrative staff help them with the registration. This is the nursing counter. This is the vaccination counter, okay, where they receive the vaccines. And the picture at the bottom is basically, this is the counseling center. Okay, this is where we pharmacists helped out. This is basically at the screening and the triage and the pre-vaccine counseling center. Okay, so we have The green text here are the 15 minutes, the red text here are the 30 minutes for observation. And we have the forms, the pre-assessment vaccine forms that we receive from other referral forms, what do you call it? Referral forms from other hospitals, from other doctors, private doctors and things like that. Okay, so this is the tri-HR screening or pre-vaccine counseling center. Okay, so to end up, this is our lecturers from the Faculty of Pharmacy on our first shift in one morning, on the first day of one morning. So, and with that, I thank you.
Thank you, Madam Shireen, for the enlightening and informative presentation. Now, I would like to pass the panel discussion to our moderator, Dr. Izian.
Thank you very much, Rhoda. So this panel discussion actually serves to, answer questions in the chat box, and also to all panelists. Okay, I think from what I'm taking notes from Dr. Nurulani, Dr. Ika, and Madam Shireen. I think all very amazing contribution towards your community, and also we can feel the passionate when you talk about it. Okay, for example, Dr. Ika managed to produce your faculty produce products, VTM, PPE, and you go to extra length to reach your community. I think that's really amazing, and we inspired by that. Dr. Nurulani, the apps and everything make things very easy over there. So we are also catching up on that, all right, trying to improve. And also Madam Shireen talking about our contribution, to our community through the teaching hospital, nearby teaching hospital at the Faculty of Pharmacy, all right? So the first question in the chat box will be, I think it's posted by Dr. Mas, whereby maybe I think Dr. Ika already answered it. If you want to, explain it, in detail, the question is about, with all these struggles, as an academician, but also you need to, go additional work because your community needs you. How do you actually preserve your mental, emotional health to juggle all these things, while also you want to accommodate your new routine as well, yourself, right? Your family, your environment, at the same time, the job at the faculty, and then the volunteer and so on. So how do you do that? Yeah. Can I first ask Dr. Ika, if you can share with us how you do that? That's really amazing. How do you also empower your staff, your colleagues to go with you, and then also, contribute so much to the community? Dr. Ika or Dr. Nurulani, Madam Shireen, I think, yep, anyone who's ready, you can just, share your experience. Dr. Nurulani ada? I think mungkin sebab Dr. Ika pun sekarang she is also working at the vaccine center. So maybe if, Dr. Nurulani, if you want to share with us, you can go ahead.
I'm not sure. I think it's really hard questions. It depends on the individual as well. Yeah, I think all this balance need to be there. Our mental health is very important. I think that's the top topic nowadays. Even in the UK, pharmacists, they raise the question about pharmacists are being, or the frontliners, in fact, not just pharmacists, are being stressed out, yeah, and being stretched with all the workload, and also they because of the pandemic, I think this happens. So in Brunei, there's also like NGOs there to actually help out, and there's this hotline to help out those in needs. But I think for me, I think it's we try to, although Brunei is very small, we try to manage our people as well, yeah, just to make sure everyone is in the right form. Just for your information, we also vaccinated around 1,000. It goes up to 1,700 per day now. So it's really, really stressful. No break, no lunch break. It's only one of us that works from, I have to be there around 7 a.m. Or in fact, I have to go from home at 6:30. And we work till 4:30 straight hours, no lunch break. But the lunch break, we between us, just to make sure everyone is covered really. So, but there's no official lunch break. So nowadays, the number of patients coming is 1,700. We work from 8 a.m. to 3:30 p.m. the official time. But of course, as you know, those who work in the vaccine, and they never, strictly speaking, never ends 3:30. So sometimes it ended 4:30 and all the packaging, tallying up the numbers of vaccine vials being used. That's really a challenge. So what we did was we worked 2 days in a week. So between us, 3 pharmacists working 2 days in a week. The difference, I think, is because we manage the vaccine and the withdrawing part at the central processing area, but we don't really deal with the monitoring of patient. But we do manage the quality control, the AEFI, with the support of the Ministry of Health Pharmacists. So for the monitoring of patient post-vaccination, this is normally handled by the doctors in charge at our center. Yes, it's coming into big numbers. It's really challenging task, I think, for everyone. But I think the spirit of hard working and teamwork was there. The students are really, really amazing. Their energy. Now they're helping out the national vaccination program at the indoor stadium every Friday, in fact, because the government is wanting to roll out the vaccine to public for those who cannot access the similar app like you guys, My Sejahtera or My Vax. We have the Blue Health app here. So some group of people who don't manage to open that app in their phone, due to technical issue, they can do that and vaccinate every Friday at the indoor stadium. And there, our students are also working, helping out to volunteer, and there they can vaccinate 4,000 people per day. So this is really like a challenging time for Brunei as well. I think we just have to keep each other safe, and there's a protocol whereby we also have to swab ourselves every 2 weeks. Yeah, just to make sure everyone is negative and safe zone, green zone, whatever you call it now, red zone, green zone. Yes.
So Dr. Nurulaini, meaning that, the UBD staff who works at the vaccine center needs to be swabbed every 2 weeks.
Yes, not only staff, cleaner, students, electrician, whoever enter the premise.
Whoever entered the vaccination center premise or the university?
The university, we call it the UBD Vaccination Center. So for example, cleaner working there every day as well, they also need to be swabbed every 2 weeks to make sure they are negative. This is using PCR, not the antigen rapid tests. Yeah, so because that's more accurate, I believe. So the real time, it's free for everyone. We just book via this app. In fact, I just did my swab this morning. So it's a drive-through swab. It's very easy to do. So and we need to report to the management, tell them that we are negative. So this is another measure to make sure everyone is fit and healthy to work. And yeah, so the difference is we don't really manage the monitoring of the post-vaccination, but we manage the vaccine. Our vaccine are not kept in the university. They're being delivered by the state medical store unit, by the Royal RBTS, is an army force. So they deliver every day in the morning, 6:30. So we have to be there to take it, and we also do the inventory and all that. Can I ask question to Madam Shireen?
Sure, sure.
Okay, so my question is, how do you ensure, you mentioned about wastages at the end of the day. This is also another issue that we face. Like you were saying, one vial is 6 doses. So what happen if there's only like 2 patients coming in? How do you manage this? I know, like Malaysian, you have to travel all the way, right, to be there.
Yeah.
To go to PJ, I imagine. Brunei, we're very small, and yeah. So, and how do you select who gets Pfizer, who gets Sinovac? Is there like
Okay.
criteria?
Yeah. Okay. How do we get patients? Let's say, for example, we usually have, according to the My Sejahtera, they will already put in which patient will come in which day and what time. So, but sometimes patients do not come in because they are not well, or they will receive another appointment on another vaccine center or something like that. So we do have, let's say, for example, one vial should be for 6 people, but only 3 people turn up. So what happened is that we have a team of nurses who will call patients who have already registered to come in for vaccine, but have not gotten their dates yet.
Right.
So early, let's say, for example, 2 o'clock, they will know, okay, this patient has come in, this patient has come in. 3 o'clock, then we will, whoever is not coming in, by 3 o'clock or by 4 o'clock, they will say, okay, we still have 3 people, let's say, for example, 3 people, three slots empty, 3 doses empty. Call this person, call that person, call this person, call this person. So whoever can come in within the people that they call, if they say, okay, they can come in within an hour or within half an hour, then their names are already in. So we
So
have
you never turn down patient. Have you ever turned down, like you ask them to go home, come again tomorrow? No? I don't know. We sometimes do that.
What happened is that they have their appointment dates and time from their My Sejahtera. So once they have the appointment dates and time, we do not turn them down because they already have the appointment. For walk-in patients, we have every day we have certain allocations, like say 30 doses for walk-in patients, or 50 or 60 doses for walk-in patients. So for walk-in patients, whoever comes in first, fill in the 30 doses or 60 doses. For the 60 doses, they will get their vaccination. Provided that they fulfill during the screening, is everything clear lah, tak ada anything pending and things like that. Pending means, let's say, for example, if the patient has been warded positive for COVID, has been warded for stage 5 and is on monoclonals. Okay, and then 2 weeks later, after 2 weeks later, they come into the hospital, walk in to get vaccinated. So that tak boleh. They have to at least be 6 weeks after the monoclonal, only then can come. Things like that lah. So for the walk-ins, as long as they are okay, clear to go for walk-ins, and within the 30 to 60 doses, they will come in. After that, once the slot for the 30 or 60 doses to habis, then we will get them to come in the next day. So that is for walk-ins and patients. Then for those who did not come, we'll call them up. For those people, let's say, for example, within the area, what we call it, list. They have the name for the list, standby list. Standby list. So those
It's
people
like a wait list. a
Yes.
waiting list, like
Yes.
going to an aeroplane.
Yes. So it's usually within.
Amazing.
Sorry.
It's an amazing because your client, you are only for special a certain criteria, and that's
Yes.
really hard to me, like to get that patient, but you already have a list, yeah,
Yeah.
and they can come within like 1 hour.
Yes. Yeah.
They do.
They do.
Mm.
We do have patients as far as Malacca, which is about 2 hours drive. 2 hours drive. We have as far as Terengganu, which is about 4 hours drive, 3 hours drive, something like that. We do
Wow.
have patients. Yeah, we do have
So
patients come in. Those
in
patients
the
are.
in the whole of Malaysia, it's only UMMC offer this SPV and Kelantan, is it? You mentioned.
As far as I know, yes. I'm not sure what other
So
hospitals
there's
yet.
only 2 in the whole of state of Malaysia. Oh,
Yeah.
nice.
That's right, Dr. Nurulani, because UMMC catering for high risk patients, their own patients. So definitely there will be follow up patients around the states, or, I mean around the country. So if they are, because UMMC specialize in I think maybe pediatrics or oncology, and so definitely there are UMFC patients, and the specialist actually will ensure, hey, these patients actually fit for vaccine, so they will not go and get it from anywhere except at PPUM.
Yeah, it's a special client you have. One more question, maybe. You have rolled out the pediatric group, is it? What are
Yes.
the side effect, or what are the adverse effect that you have noted so far in the last 3 weeks? Is it 3 weeks? Pediatric group, 12 to 17, right? Is that?
Yeah. The pediatric group, that the one that we see we seen in the first 3 weeks too, is basically pediatrics with comorbidities. So patients with ASD, heart failure patients, patients on immunosuppressants and things like that lah. Pediatric patients on immunosuppressants and things like that. So far, alhamdulillah, tak ada apa-apa. Cuma at the counselling section, there has another one thing that you have to inform them about, myocarditis and pericarditis. So this myocarditis and pericarditis is not that you ambil inject today, you will get this myocarditis or pericarditis tomorrow or the day after. It will develop 3 weeks or 4 weeks or 5 weeks later. So we have to inform the mother. Usually the parents, one of the parents will come in, because the parents will need to give the consent, not the child. We will inform the mother to continue monitoring patient, basically where the patient has chest pain, where the patient has breathlessness or shortness of breath, palpitations and things like that. So far tak ada lah yang from the in our center, tak ada.
Madam Shirin, ada question dekat chat box from Dr. Masrina Wati. 2 questions. Madam Shirin, your clients are from the hospital. Did you get any clients as walk-ins? If not, why not? So that is first question. Okay. Ada banyak sub-questions too. Secondly is that in your vaccination system at UMMC, what really works well in your opinion? And there is a balance between vaccination duties, academic tasks, and having a family to go home to. So yeah, all tough questions, Madam Shirin. If you can share your experience, definitely, yeah, it will be something for all of us to ponder.
For the clients are mostly hospital, because they are patients from our hospital, and that all over Malaysia. Like I said, we do have patients from Melaka and Terengganu and things like that. We do have patients. We do have families of staff, which means if your daughter or your son or your husband, if staff members of the staff members, they do also come to the UMSC to get vaccinated. Yeah. Other than that, we do also have walk-ins, like I mentioned earlier. If the slot is for 30 people for that day, then the slot is for 30 people. If they finish, then they ask them to get to go the next day. If the slot is for 60, then it's for 60. Okay. In your vaccination system, what really works? Okay, we are so lucky because at the moment the students are having holidays. Okay, so we don't have lectures at the moment. These lectures will only start mid next month. Okay. Yeah, the only lectures will only start mid next month. So at the moment there's no lectures. So we only do have to do administrative stuff, research, and this clinical duties lah, and as SPPV. The same thing also when, especially if you have this is what I did lah. When I go, because my elderly parents are with me, they are about 80s, in their 80s. So what I did was I make sure that I have my bath. I will have my bath in the hospital or in the department before I go home. Change of clothes and things like that lah. So that we don't transmit whatever that we have from the PPV, from the ward to the at home. Because at this moment also for the last 1 to 2 weeks, I'm covering also ward. So that's one of the things lah, to make sure that we don't bring whatever the germs from the hospital back to the house. Duties or tasks, I think kat mana pun we have to do. I mean, we are juggling it lah. We were juggling it to the best of our effort lah. Itu. I hope that I've answered your question.
Thank you. Yes. Very interesting.
Thank you, Madam Shirin. Is Dr. Ika is around? We would like to hear from Dr. Ika, your experience juggling with, work at the faculty, with the community, and also with the research, because I think that's very, the output from UGM, the VTM, and also PPE, I think that's very significant contribution. Dr. Ika, are you there? Okay, maybe I think she's really busy person. We can see, we can imagine and saw that earlier, right? But never mind. So I think if there are no more questions, I think there are pretty much wrapped up by all panels. And then I'll hand over to Aina. I think it's already nearing lunch time already. Many people already leave out. So that's all for me. I hand over to Aina. Thank you so much to all panels.
Thank you.
Thank you, Dr. Izian and Rauda, for moderating today. I would like to inform everyone that we have posted 2 links in the Zoom chat box. One is where you enter your details on a form to be put in the certificates of participation, and other link will be the feedback form. We will distribute the completed soft copy certificates through your email after you completed the form. Do check your spam emails or junk mail, as it was reported that it may be categorized as spam. And should you have any inquiries, please do not be afraid to email us at ubd.ipw.wpd2021@gmail.com. And that marks the end of the session. And with that, we would like to thank the participants of the webinar, Pharmacist's Role During COVID-19 Pandemic. We hope you gain more insight through this conference. I'm Aina Zayani, and all of the committee would like to wish you a wonderful day. Thank you for your attention, and good afternoon from Bandar Seri Begawan, Brunei Darussalam.
Thank you very much. Well done, everyone. Thank you to all participants. Thank you.
Thank you, Dr. Izian, for sharing. Thank you, students, the cohort 5 pharmacy students, for doing all the hard work behind this.
Thank you, Dr. Nuralni. Thank you, Dr. Masrinawati. Thank
you,
you.
Dr. Mas.
Nice meeting you online from Malaysia.
Thank you, Madam Shireen. Glad that your internet is back on.
Thank you. So sorry about that just now.
No worry. It happened. Also, Dr. Ika, she has left, is it? I think she has left. Right. Have a good weekend, guys. Stay safe.
Thank
Good
you.
weekend.
Take
care. Bye.
Thank you very much. Nice to meet you all in the online session, everyone. Yeah.
Bye.